there, my name is Shenna Dethi. I'm here at the Digital Health Summit Live Studio with my friend David Inns with GreatCall. He's the CEO, and actually David and I used to work together. So David, let me ask you, I was very excited to hear about Lively and the new launch of Lively. Do you mind talking a little bit about that right now?
Sure. It's actually a little bit separate from the company Lively originally. So we did acquire the company Lively a few months ago, but we liked the name so much that we took that name and we applied it to the new wearable. So we call it the Lively Wearable by GreatCall, and it's essentially the first wearable that has been truly designed for the older consumer with their needs and the entire experience rethought. Because if you basically take and you look at the general wearable market, that's an experience that's been designed for a 20 to 30-year-old fitness buff.
Right.
And taking that experience and thinking you can just port that over and give it to a 70-year-old woman who just wants to stay a little bit healthier, that's just not going to work. So we really looked at all the barriers to both getting interested in wearables, but also even, there was an AARP study that showed 58% of the older consumers who tried a wearable stopped using it within the first 6 weeks. So we also looked at why that was happening and really worked on making it an engaging product so that the older consumer wants to use it, they have a benefit of using it, and it ties the family caregiver in so they have peace of mind and they can see how their mom and dad are doing as well.
Well, that's great. I think it's really exciting, and you're still very focusing on that market. And I also noticed that you're doing a lot in the space of caregiving as well. So why don't you tell me a little bit about how you're expanding into that space, and you're on a board, I believe, correct?
Right. Well, we help coordinate what we call the Caregiver Alliance, which we took a lot of for-profits and not-for-profits that are working in and providing help and content to caregivers, family caregivers. And we basically formed a council to try to increase awareness of this really important role that people don't really talk about, people don't know much about it, and family caregivers themselves don't consider themselves caregivers. So there needs to be more awareness so that we can create a market of tools to help them.
Right.
But if they're not out there looking for tools because they don't even know that they're out there, then it's obviously a problem. So that's what we're trying to do, is create that. We started working with caregivers the first product we launched is called GreatCall Link, which basically takes the data around the activities and the routine of our older consumers and analyzes that and then presents it back in an app to family caregivers so that they can have peace of mind remotely on how their mom or dad are doing, or whoever it is that they're looking after or feel responsible for. So it's a really powerful tool for increasing the productivity of the caregiver and improving their peace of mind, giving them more peace of mind.
Wonderful. So is there anything else that we should know about what GreatCall is doing, and what plans do you see for the future, even in the caregiving space?
Well, what we're really focusing on in the caregiver space is continuing to just provide more intelligent information back to the caregiver. Not an abundance of information, but really taking the information we have, which is very robust about our older consumers, and doing the analysis on that to prevent really valuable information. So the more data we're collecting, then the more robust that information can be going back to the family caregiver. But what we actually work with an artificial intelligence company to take that data and generate it into a very simple report that is presented to the family caregiver every week, so that you're not looking at graphs of here's mom's heart rate going up and down and stuff like that. The family caregiver is just totally overwhelmed with and won't know what to do with. And so instead, being very simple in the way that we take the data and present it back so they find it useful, they know what to do with it, it doesn't intimidate them, and it keeps them engaged in the person they're taking care of's lives.
Right, so you're really giving them actionable, what we call actionable data.
Exactly. Simple, clear, and actionable.
Wonderful. Well, thank you, David, for coming into the studio for the interview today. It was great seeing you again.
It was good seeing you. Thanks.
And this is Shenna Dethi. Thank you from the Digital Health Studio here live at CES.